Doctor, I am not able to reverse my diabetes because I take almost all my meals at hawker centers or kopitiams. I cannot change that because of my work situation. Therefore, I don't think I can reverse my diabetes because hawker food is so unhealthy. That was what my patient Marcus said to me during a coaching session. Hi, I'm Dr. Chan. Let me use the story of Marcus to answer the question of whether a diet consisting mainly of hawker food can help reverse diabetes. Marcus is not a real patient. His story is a composite drawn from my years of coaching people with diabetes and other lifestyle-related chronic diseases. But his story reflects how many of my diabetes patients see hawker food and diabetes reversal. Before I continue, I would like to ask you, what do you think? Would you agree with Marcus? Can a person still reverse his or her diabetes with a diet consisting mainly of hawker food? Is your answer yes or no? From my 10 plus years of experience coaching patients with diabetes to make dietary habit changes, my answer is maybe. It is possible to reverse diabetes even with a diet consisting mainly of hawker food. Is it ideal? No. Would it be easy? No. But is it possible? Yes. Not guaranteed, but possible. Because a diet that can help reverse diabetes does not need to be 100% perfect in every way. If a person's goal is primarily to reverse diabetes, the new diet just needs to be better than the old diet at lowering blood sugar and reducing insulin resistance. So if you're asking whether a diet consisting mainly of hawker food is advisable as a long-term healthy diet, the answer is clearly no. But if you're asking whether a person can still achieve diabetes reversal after a few months with a diet consisting mainly of hawker food, the answer is possibly yes. Not guaranteed, but there is a reasonable chance if the person makes appropriate and adequate changes to the kind of hawker food chosen, consistently making new choices that are better at minimizing blood sugar spikes, consistently making new choices that are better at reducing insulin resistance, and doing that consistently over a period of time. So the point is not whether it is hawker food or not. The point is whether your new hawker food choices are better than your old ones at reducing unhealthy blood sugar spikes and insulin resistance, and whether you can sustain those choices consistently over time. So many people at this point would probably ask me, Doctor, just give me the list of hawker foods that are healthy that can reverse diabetes. My answer would be there is no such list. There is no such one size fits all list. Because the question is not about whether a specific hawker food is good for reversing diabetes. The real question is whether your new hawker food choices support the mechanism you have chosen to attempt to reverse your diabetes. What do I mean by that? Let me explain. Some people use a calorie restriction diet to try to reverse diabetes. Others use a ketogenic diet, and yet others use a mainly plant-based diet. The underlying mechanisms that contribute to reversing diabetes are different for each of these different dietary approaches. And not all of these dietary interventions are suitable for every person with type 2 diabetes. It will have to depend on a person's dominant diabetes pathophysiology, the severity of the diabetes, what other medical conditions they have, what medications they are taking, and what diet they are currently practicing. So the new hawker food choices made to support one's attempt to reverse diabetes must be individualized. They must align with the chosen dietary strategy and its underlying mechanism. That is why in my one-to-one coaching session, I do not simply give patients a list of foods or hawker food choices that are supposedly good for diabetes. I will first assess and understand the patient's diabetes, the underlying pathophysiology that may be contributing to their condition. There are other medical conditions, the medications they are on, the problems in their current diet, and their home and work environment, especially in terms of food access. I also take the time to understand their food preferences, their likes and dislikes, their favorite hawker foods. Only after that, do I propose a possible dietary approach and strategy to improve their blood sugar control, and where possible to even attempt to reverse their diabetes. And only then do I make specific recommendations on what they should aim to change when eating at hawker centers. I think this is a good moment to return to Marcus, the story of Marcus that I shared earlier. Marcus wanted to attempt to reverse his diabetes through lifestyle and dietary changes, but he did not think it would be possible, given he had no choice but to eat at hawker centers most of the time. So I spent some time educating him. I highlighted that even though Singapore hawker food is generally not ideal for blood sugar control, it's generally not so healthy, but there would always still be room for him to make better choices when eating at hawker centers. Choices that would support his chosen dietary approach and give him a real chance at improving his diabetes, with the hope of even possibly eventually achieving diabetes reversal. I assessed his usual hawker center choices. I gave him specific suggestions on changes that he could make, and then I coached and supported him through those months. Over time, his blood sugar control improved, and he needed less diabetes medication. He improved further and eventually came off medications altogether. Marcus did not change where he ate. He continued eating at hawker centers for most of his meals, but he changed what he chose to eat at hawker centers, and that was enough. Again, Marcus is not a real patient. His story is a composite drawn from my years of coaching Singaporeans with diabetes, and it reflects what I see in some of my diabetes patients. My purpose in sharing this composite story is this. I want to encourage people with diabetes that dietary improvement should be made as early as possible. Just because your home or work situation requires you to eat most of your meals at hawker centers does not mean you cannot improve your diabetes control or even possibly reverse your diabetes. You do not need to wait till your situation changes. When it comes to combating diabetes, changing and improving your diet is critical, and it should be done as early as possible. Do not wait until your diabetes condition becomes so severe or complications set in before you make the effort. If you have diabetes, do not wait for the perfect timing or the perfect environment. Start as early as possible. Start with what you're willing and able to do. Do not let perfect get in the way of good. You do not need to be perfect. You just need to focus on making your food choices at hawker center better, one step at a time. And do not let eating at hawker centers stop you or delay the critical work of improving your diet to combat your diabetes or to attempt to reverse your diabetes. So if you ask, is it possible to reverse diabetes if you have to eat at hawker centers most of the time? My answer would be not ideal, not easy, but not impossible. It may be possible if the right targeted changes are made consistently enough. I also want to take this opportunity to highlight something very important to every person with type 2 diabetes. Type 2 diabetes is potentially reversible if lifestyle and eating habits changes are made early enough, appropriately, adequately, and sustainably. But the window to reverse your diabetes does not remain open forever. The earlier you try, the better your chances. Most people do not have a comprehensive understanding of diabetes reversal, and that is why I created a structured online learning program called Reversing Type 2 Diabetes, the Essential Basics. I hope you would equip people with type 2 diabetes with the must-know foundational knowledge of reversing diabetes. If you're keen to find out more, the link should be somewhere in the description or notes of this episode, depending on where you're watching or listening. And if you want to find out more about what I do and how to contact me, you can visit my websites, thehabitsdoctor.com or thehabitspharmacy.com. I hope you have found this useful. I'm Dr. Chan. Your habits can be powerful medicine to combat diabetes and other lifestyle-related chronic diseases. Choose better and get better. Eat well and be well. Take care.